Well, Preston, Mary, the group that had been inside, about 10 to 15 people, has since been cleared out within just the last few hours. And now Tacoma police are essentially keeping an eye on the school to make sure they don't come back. It's unclear just how long they're going to stay out here. As for this building, this is a live look at it right now. We're told it is falling apart, that it is ridden with asbestos, that parts of the roof are collapsing, and that it is just not safe for people to be inside. But that group says it's better than being out in the streets and out in the cold. Tonight, police eventually moved in wearing that protective gear to get everyone moved out. Our camera caught them bringing out a few things that had been left inside. This was all discovered at around 2 o'clock this afternoon when a school patrol noticed that a boarded up entrance had been broken into. That's when officers with Tacoma police were called in, and initially that group refused to leave. Tacoma Housing Now says this was done to get people off of the streets as the nights grow longer and colder, saying 2 people have already died because of the dropping temperatures. Here's what police and someone with that group are saying about what took place here.
And basically told people when they found them inside that you have the option of leaving voluntarily, and we will still connect you with resources and find you somewhere to stay for the night, or you will be arrested for burglary.
Every night that houseless people are sleeping on the streets is a night that they could die. And we are extremely disappointed and sickened by the school district's decision to sign off on the cops threatening us with felonies.
Tacoma Housing Now is demanding that the city turn over the school and other old vacant buildings to a community land trust to then be turned into housing. There was a plan in place to renovate this school for low-income housing, but the pandemic essentially ate up those funds. Now, back out here live, as for that group, they say they will continue this fight and that the city has failed the homeless population. The building has since been reboarded up. We are told that no arrests were made tonight. Back to you. Of the COVID-19 pandemic, the Evergreen State once again setting a new record Saturday. This time, it's the number of hospitalizations due to the virus. 762 people now taking up beds, according to the COVID Tracking Project.
I'm very, very worried about it.
Cassie Sauer is the CEO of the Washington State Hospital Association.
In various parts of the state, hospitals are beginning to cut back on elective surgeries.
We've learned that UW Medicine is actively contacting patients to postpone some surgeries, specifically those that would require a stay of some kind post-op.
It's not facelifts. These are joint replacements, heart valve replacements, even, potentially some cancer surgeries being canceled to make sure that there's room for COVID patients.
Over at Swedish, a similar approach is being taken. Just earlier this week, 10 COVID-19 patients were admitted to the First Hill campus in a span of just 5 hours. Dr. Elizabeth Waco is the chief operating officer there.
We've reduced inpatient elective surgeries to allow us to expand our inpatient urgent and emergent medical beds. Our teams are tired, they are fatigued, but they are resilient, and we will continue to fight COVID.
And it's a fight that they cannot wage alone. In this battle, it takes everyone.
Your healthcare workers want you to not get sick, and they are so frustrated by feeling like people are ignoring the advice and then coming in and getting sick and expecting to be cared for in a high-risk situation.
For some folks going to public sites in King County, they've been able to get their results back within 18 hours after getting the test. But even with those long lines that we're seeing now, Public Health Seattle in King County says their turnaround times haven't changed. This is the theme of what people could expect when looking to get a COVID-19 test this week in King County. Long lines, lots of cars, and folks waiting to get their noses swabbed for the coronavirus.
COVID-19 cases have been increasing in King County, regionally, and across the country.
And because of that, and Thanksgiving coming up next week, more people are reserving spots to get tested. This chart from the State Department of Health shows how average daily testing has increased statewide. So far, Duchin says it hasn't impacted our supply.
Our capacity is adequate in the county, but we are seeing increasing demand with long lines and longer wait times.
But according to the county health department, that hasn't overwhelmed the labs analyzing these tests. A spokesperson with Public Health Seattle in King County tells KOMO News that they're not seeing longer result return wait times, saying in part that, quote, median times on days this week have been 38 hours or less.
We are very concerned that if this outbreak continues to expand, or during the winter season, other viruses, influenza and other viruses will cause people to have symptoms that will also lead them to seek testing, we'll see increasing strain on our testing.
It's why officials are hoping people will only get tested if they've been near someone with the virus or they themselves are experiencing symptoms.
We know testing is one of the critical things we need to have in place to fight this virus. We know the best defense to this virus are the actions we take ourselves.
Preston, 375 healthcare organizations across the state have applied to be vaccine administrators. Swedish, though, it's one of only 6 that have been approved so far, and they're laying the groundwork for what's sure to be a monumental effort.
Now that Pfizer has applied for emergency use approval of its coronavirus vaccine, the nationwide distribution plan is more urgent than ever. Swedish Health Services is well on its way.
We have a very complex workflows and scenarios, multiple scenarios.
Chief Nursing Officer Donna Jensen says a big unknown is how much vaccine Swedish will initially get. Swedish has plenty of cold storage space for the Pfizer vaccine, but is still trying to balance out staffing concerns.
Staffing is always a challenge, so we will have to see how much vaccine we receive.
Each dose should come with a kit that includes needles, syringes, and swabs to hopefully avoid the shortages during the early days of COVID-19 testing when reagents and lab materials ran low. Another hurdle is the CDC's new daily reporting requirements on who has been vaccinated. Swedish says record systems will need some adjustments.
There are software interfaces that have to be tested.
Another huge challenge is the time this will take before we can finally feel safe.
It could take up to as much as a year before we have an adequate amount of the community vaccinated to have a true impact on the pandemic.
Hey everybody, I'm Eric Johnson from KOMO News. Thanks for checking out the KOMO YouTube channel. You can see more of our videos right here by clicking on the video links for more news from the Seattle area and all of Western Washington. And don't forget to click the subscribe button below so you don't miss our YouTube updates.